How many times do you take your animals to the vet for a routine visit yearly? Most households have 1 to 2 animals or more, and approximately 85 to 90 million families in America own a household pet. Just around 60 million are dog owners, and 30 million are cat owners. Working at a local veterinary clinic has taught me the importance of caring for your animals carefully and responsibly. For puppies, we offer 4 rounds of vaccines that they receive every 3 weeks to prevent from illnesses that they can get. DHLPP is short for distemper, hepatitis, lepto, and parvo. If it's a shot that they can get to prevent from all of those diseases. Distemper is short for a serious infection that attacks the intranasal tract, respiratory tract, and central nervous system. The infection is very contagious and can be caught through any bodily fluids. Hepatitis is an inflammation in the liver and causes an invasion into the liver through the bloodstream. Lepto spreads through the entire body, reproducing the liver, kidneys, and central nervous system, eyes, and even reproductive systems. Parvo is a highly contagious infection that they can get as well, and most common form of parvo is from the intestinal form. These symptoms include loss of weight and loss of appetite, bloody stool, and even bloody vomiting. DHLPP can be given to dogs that are over a year old, and DA2PP is given to puppies that vaccine does not include lepto in it. The next shot given to your dog would be the Bordetella shot, also known as a prevention for kennel cough. Kennel cough is an airborne disease that can easily be transmitted through air, and your dog would be making a loud hacking noise, and sometimes it can be a consistent noise or every so often that they can be affected with it. Lyme is the next shot that they would also recommend for more outdoor dogs. Lyme is to help prevent from Lyme disease tick scary. The last shot your dog will need and is also or always must be seen at any vet clinic in the state of Mississippi is the rabies vaccine. Rabies is also a well-known virus that is spread by contact with saliva from any infected animal. Also, it's spread through a bite wound of any sort, and can be spread through a scratch or even a tiny paper cut. Although, another major thing is to always make sure that your dog is up to date on heartworm prevention. Many dog owners don't realize that heartworms can actually kill your dog. They can get heartworms through a mosquito that is infected, and all it takes is one simple bite. If your dog does have heartworms, it's very hard to cure and to get rid of. The options you can do is surgery, which is very expensive, or the aminicide injection, which is a slow kill pretty much for heartworms, and it takes pretty much up to 6 months to a year for them to completely clear out. And it doesn't always work. You need to always keep your dogs on heartworm prevention, and you can start them as little as 6 weeks old. They must be on it their entire life. Their symptoms can start as little as a cough and can expand to a lack of eating, exercise, fainting spells, and even chronic heart failure. Lastly, you should always bring them in yearly for their physical exam like you would for even your own child. They will check their teeth, heart, ears, lungs, joints, and so much more to make sure everything is going okay for them. If your dog is even at least over 7 years old, you can always ask for a yearly blood work exam to check for functions of their liver, kidneys, and even glucose. Always remember that if you go to the doctor yearly for your exam and blood work, for even shots too, remember that your dogs are just like humans and need theirs as well. Overall, taking your dog to the vet once a year is always good to make sure that they have a happy and healthy life.